Machakos County has been listed as one of the counties that had spent a lot, especially when it comes to local travel. And one asked the question, whilst travel one would say there has to be return on investment on what that travel then means to the county. Can Wananchi, residents of Machakos, say we spend, say, 300 million for travel and we see return on investment, say, double the amount because something has come out of that travel? Or are we just spending on travel because we can travel?
Well, that's a very good question, and the begs an answer. I'm sure it's a question that millions who are watching are expecting to hear what the thing is. But I want first to make it on record. I've traveled almost 3 or 4 times this year, but not on any public send. And not even an allowance from the county or on my own. Secondly, sometimes when you travel, it depends on what is dictating that you move. That traveling most of the time, I believe, is about maybe attending a training somewhere, an invite somewhere, and I think it has value in my view from where I sit. For example, we were doing county health reforms. There was a lot of outcry, and when we were coming in, there was a lot of every corner, and literally the health was literally death. So there was a lot of even internal going to see what is this other county, like Nyeri, county of Nyeri is doing very well when it comes to issues touching on health. Murang'a the same. We had to move, because I'm saying this because I was involved, I was leading it. And today, as I sit here, anybody in Machakos can attest that we have moved from that deathbed to a healthcare that is making even our people not to receive proper health care because of other people coming from neighboring counties where we are leading. Majority, almost more than half of the hospital beds across Machakos County, whether it's Mavoko, Machakos Town, those beds are occupied by patients from Nairobi. I'm not saying it's bad, but I'm trying to say to emphasize on the improvement that the governor and our administration has managed to put in place. So for me, I'm seeing value for the money.
I want to ask the question, when you went to Nyeri County, what did you find in Nyeri County that Machakos was not doing that you implemented and brought about the change? Why do I ask that? Because if you look at what perhaps the other county has done, could be on policy perspective and directive. And if it's based on policy, shouldn't that just be a phone call away?
Well, sometimes you are right. It could be, you can communicate using technology, using phones and even emails. But I will tell you one thing, seeing is believing. Seeing how actually something is being implemented from point A through B to C, D is very important. So in terms of policy, yes, we saw and compared with what others are doing. And that is the reason within 3 years, we have managed to change healthcare status in Machakos County. So it is policy, plus also, you know, somehow a human being has to be motivated in one way or the other. How do we do it? Different organizations have different parameters that they apply to ensure the same. Anybody who is motivated goes out of their way to deliver something to the benefit of the public who put us into those positions of leadership. So it's both management-wise, leadership-wise, and policy-wise. Yes.
Are you